Okay, hi everyone, my name is Kayla, and early this year in January, Sophie and I spent 4 weeks volunteering in Nepal. Projects Abroad was the organisation we volunteered with, and we were situated in the Lalitpur district just outside Kathmandu Valley, and we lived and worked in a suburb within that called Sunakoti. So, as we can see here, Chakra and Menaka were our host parents, and they have 2 young boys. Simone is now 5 and Saman is 4 years old. So as you can see on the left there's Menaka, our host mother, and her son, and then her son is also the youngest one in the next picture. So Menaka had 6 sisters and 3 brothers who we spent a lot of time with. You can see some of them there. So we got to experience a lot of the different family events there. We volunteered at Kathmandu Nutritional Rehabilitation Home, also known as NRH. NRH is a health facility for malnourished children that provides treatment for them free of charge. Children between the age of 0 and 15 are admitted to NRH for a period of 3 to 4 weeks, and they live at NRH with a guardian in one of the 4 dorms provided. So you can see the dorms up the top right. And Sophie and I also collected some money and donated the blankets that are on the bed to keep the children warm. So while we were there in the January period, there was no more than 22 children admitted at one time, although there are 4 dorms and 8 to 10 beds at each time.
Currently, the World Health Organization classifies the malnutrition in Nepal at crisis level. So to improve nutrition among children, the Nepal Youth Foundation established 16 nutritional rehabilitation homes across Nepal and has rehabilitated more than 10,000 children to date. The goal of NRH is to reduce the child mortality rate caused by malnutrition in Nepal. The objectives of NRH are therefore to restore the health of severely malnourished children and to provide nutrition education to parents, caretakers at the same time. This photo is an example of a child who was treated at NRH, and this is before, and the after is 4 weeks after he gained enough weight for him to be sent home. Volunteers at NRH have 3 areas where they can assist. The first one is care, which involves playing with the children and helping out with the mothers. You could also help out the kitchen staff, which involves cooking and cleaning, and the other one is administrative work, which encompasses a wide variety of jobs. While we were there, we got involved in a number of activities.
So to give you a little insight to what we did each day at Nepal, we're going to go through what we did. So each day we'd walk past these magnificent views on our 10 to 20 minute walk to our host organisation. So around us were a lot of farms, and we saw buffalo and rice paddies and things being grown in the farms there. So we got to NRH at about 10 a.m. and we'd usually organise the activities for that day. Then at 12 we always ate dal bhat, a Nepalese staple, 2 times a day, and practically their only meal. We quickly learned to say ali kati, which means a little bit, because their servings were so huge. Through the afternoon, we would usually play and spend time with the children, and towards the end of the day, we would spend time in the really cold office doing administrative work and planning the activities for the next day. So as I said, a lot of the time was spent with the children. We planned activities for each day that usually involved an attempt to incorporate education, as the children do not go about the normal routine while at NRH. So they're there for a period of 3 to 4 weeks with their parents. They stay there on the weekends, on the weekdays, and if there's any schooling that they usually do, nothing happens. They just stay at NRH and get treated there. So we really wanted to, while we were there doing the activities, incorporate some education for them. So there's a wide range of ages at NRH, and so it was very difficult to find out which activities would work for all the kids. You know, we had kids, some at the very beginning, a lot of them were about 2 years old. So we found that activities like drawing and various colouring activities was the best way to involve a wide range of children, especially at many developmental stages, because a lot of them are developmentally impaired because of malnutrition. So for the older ones, this sometimes meant reading stories or writing words, and for the younger ones, it could just be holding a pencil and watching us playing with the kids. So yeah. So we can see some of the kids we spent a lot of time with. We tried to get every kid involved, even if they weren't that responsive. So you can see that with the middle child, who then found it hilarious that she had a hat, but it took her a little while to get involved. And we also made paper chains, which is a good way to get every child put in to make one creation, which was really nice. So we handed out rectangle pieces of paper, and everyone did, as much as they could do, and then we put it together. Amit, also on the right, a very quiet, sweet boy, and our translator while we were there, and he was just so perfect and would just sit doing his crafts when everyone else was running crazy. So while at NRH, we were always at this balcony. This is where we did our activities, played with the children, anything like that, and they always sat there because it was sunny, so they were very cold, and they'd sit there each day. So you can see some of the children here. So the children come to NRH for a wide variety of, to be treated for malnutrition, but often the cause of that is from a wide variety of other things. So some were there because of a lack of income and education of their parents, and others, like you can see on the left, were there to gain weight for surgery, so the cleft palate. Children were also there for alternate conditions which were stopping the nutrients being absorbed.
So while at NRH, the children also receive other healthcare services. So doctors and dietitians and physiotherapists come and treat them. We witnessed the physiotherapy day to help some of the children. So we also got to know this child, Rabina, who really needed her physiotherapy care. She had a developmental disorder. No one can tell us exactly what it was. She's actually 5 years old, but as you can see, she looks old. She couldn't walk, talk, or crawl yet, so physiotherapists were working with her muscles and giving them other exercises to do to make her develop so she can walk and crawl. So while we were there, she actually got discharged because she gained enough weight, but she came back for a physiotherapy day, and we could actually see that, on the photo on the left, she was starting to walk a little bit, and she's in her little squeaky shoes that all the Nepalese children like to run around in. So that was really nice to see. So an aim of NRH is to provide nutrition information to caregivers to attempt to reduce the child's chance of having recurrent malnutrition. So one day we witnessed a discharge where the mother was handed a pile of handwritten, unorganised notes on scraps of paper, and she just shoved it in her bag. So after we saw that, we thought we'd come up with something like a poster that they could get on discharge, which consolidates all the information that they get on discharge and all the information that they learnt while at NRH. So we decided on 3 columns. We thought hygiene was very important, feeding practices obviously very important at NRH, and we also talked about care and difference, like Nepalese culture to us. And we included 2 menus at the bottom, which they learnt at NRH and are very important for nutrients for the children.
Yep, so this is a draft here, and it was going to get translated by the manager at NRH. She really liked our idea, and she helped us transform. At the beginning we had written where it says take a shower at least once a week. We had written take a shower once a day. So she helped us work out what was acceptable and what was, going to happen in their culture, and helped us, change it and adapt our poster to what they are. And also, hopefully, it's being translated at the moment, and it's a really simple, sort of informative poster in some way they can understand.
Yeah, unfortunately, we couldn't see the end product. We had to leave. So we got the opportunity to accompany a field worker to a slum area within Kathmandu. It was shocking to see the conditions that these people lived in. On the photo on the right is a river that didn't move much, so it's stagnant and smelly, and that's a rubbish dump in the background. And this is where the people lived, just on the other side of the river. The houses were corrugated iron with wooden planks and bits of plastic. We got to poke our heads in and see that the only furniture was just a wooden plank, and that was their bed. There was no doors or windows, so no security. So we concluded that sanitation and cleanliness wasn't highly prioritised here. So it was interesting to see, put in context, some of the children from NRH, what their lives were like at home.
Okay, so NRH also has an outreach program, and this aims to target the Nepalese population who don't have the access or knowledge about proper health care and where to receive this. So we were lucky enough to be able to go out and attend one of these outreach programs, and we went to another nearby slum area, and where there happened to be an organisation that fed 300 slum children breakfast each day. So So NRH and the field workers there decided to take us out and we would measure as many children as we could after their breakfast. So many of them had run away and found better things to do, but we managed to, I think, 150 or over 150, we measured, weighed, and recorded sort of personal information about them. And then later on, we consolidated their results, put them into the WHO classifications, and worked out what standard deviation from the weight they had and whether they were sick enough to come to NIH and be treated. You can see here the children all in the line waiting, weighing them, getting their height, and just, it was very chaotic, but very exciting. So we also participated in a painting day. Projects Abroad organised volunteers from all around Kathmandu to come to NRH, and we got to paint murals at the top balcony. So as I said, they do spend a lot of their time on the balconies because it is hot and warmer there. So getting this top balcony a lot nicer was a good thing to get for them. So as you can see, there's some volunteers painting there, and it took all day. And this is Sophie and I's wall. So it's obviously the English alphabet because there's a severe lack of resources at NIH. When we arrived, we wanted to use the printing paper to draw with the children, and we were told that that was not okay. There was no paper, no pencils, we had nothing. There was a couple teddy bears, but they weren't to be taken out of the cupboards because they were worried about the children stealing them. So it was a severe lack of resources, and luckily Sophie and I had brought some things, or we bought some things on the weekends, and we got to make sure that the kids could have a fun time. But we thought for other volunteers who may not have that opportunity that, a simple alphabet on the wall may help in some educational activities. Yes, very pretty. So just to sum up, this is all the staff at NRH. We have all the field workers in the leather jackets and the jeans, and there's Sophie and I being sent off by Sunita, the manager. So we just wanted to say a little something about living in Nepal. It was a fantastic experience. We were the first volunteers to ever be with our host family, and they were very welcoming, and as I said, 6 sisters and 3 brothers, and we got to meet almost all of them, and they're so excited to see us. So one thing we absolutely loved, and I think we did it twice and had momos 3 times, but we had a momo party, and it's when every single member of the family comes over and helps and makes the momos, and then really late at night, by the time you finish making them, you all eat them. Yeah, so that's us all doing that, and that's the family. So yeah, thank you. We actually study health science nursing, but we had heard about some of the hospitals there and that you just get to watch and follow people around. But we didn't actually say in our presentation, but we did get to go and visit a hospital and see what it was like. But we wanted to have, there were nurses at the Nutritional